So we're looking at significance of glomerular filtration rate and albuminuria in chronic kidney disease diagnosis. Yeah. So of course these are two parameters that you are looking at. If you are saying a patient has a chronic kidney disease, you are looking at these two parameters. Do you understand? Because for the glomerular filtration rate, I'm saying this person has chronic kidney disease. So I'm trying to look like, okay, how much of the kidney function is still preserved? Do you understand? For the albuminuria, I'm now trying to say, okay, has the glomerulus been damaged to the extent that proteins are now leaking into urine? So these are two key parameters I look, and this will help you to know the stage at which the chronic kidney disease is at. It will also help you to know the type of treatment that such a patient will need. Okay, so we'll take them one by one. We'll start with the introduction. All right, so there are just two cornerstones. There are two parameters. You use them to diagnose, to confirm that there is chronic kidney disease. Use them to stage, all right, to know which level this disease condition has affected the patient. You also use them to manage. Okay, so as you are treating the patient, you are still checking the glomerular filtration rate and the albuminuria to see if, okay, it's becoming better. You understand? So for the filtration rate, for definition, it just estimates how well your kidney is producing urine. Okay, how much of the blood is being filtered. Do you understand? So you are trying to know how much of waste products, important waste products like what, creatinine, is being cleared out of the body. You understand? So it's typically calculated as what, eGFR, using serum creatinine. So they can, if I want to know how well the kidney is functioning, I'll go and check the creatinine level in the body. You understand? Of course, if the kidney is clearing it very well, the levels in the body should be low. Okay, so clinical significance, it can help us to actually check out for kidney function. It can help us to stage chronic kidney disease. It can help us to know if we are going to use drugs to treat this patient. It will help us to now know the amount of dose. Okay, because most of the drugs will be cleared by the kidney again. So you want to know the amount of drug that this patient can be able to handle. So albuminuria is just the presence of proteins in urine. Of course, normally protein should not be in urine. Do you understand? So if you're having proteins in urine, it shows you that the glomerulus is having some one or two issues. So clinical significance is a marker of kidney damage. It predicts progression. Like it predicts how fast the chronic kidney disease is going. All right, cardiovascular risk. Okay, then it can also be your target when you are trying to treat these kidney issues. So that treating kidney issues, you are going back to check how far with the albumin now. Is it reducing? You understand? So why both of them matter is this. According to massive meta-analysis involving over 27 million people, lower glomerular filtration rate and the person having high albumin levels in urine shows that the disease is progressing. The disease, there's a whole lot of things that is being damaged. Do you understand? So that's just it for this. Okay, that's why we actually check out these two things if we are looking at chronic kidney disease.